Welcome back to the VQT experience. So what exactly is informed consent? If you've ever been to a therapy session or doctor's office, you've signed one of these. It's pretty much what it says. You have been informed of what you can expect from treatment, your right to privacy and confidentiality. Formally, it is the process by which the treating healthcare provider discloses appropriate information to a competent patient so that the patient may make a voluntary choice to accept or refuse treatment. The purpose of this video segment is to do exactly that, give you the appropriate information, you the competent recipient, so that you can make a voluntary choice to participate or not. So with that objective in mind, let me clearly state that VQT is designed for non-mental health disorders. What this means is that by choosing to participate, you are declaring that you are not seeking help for a mental health disorder. Okay, so the obvious question might be, how do I know that? Good question. Mental health disorders are described, categorized, and outlined in the DSM, the Diagnostic and Statistic Manual of Mental Health Disorders. This is the Bible of mental health descriptors published by the American Psychiatric Association. It's the manual that all mental health professionals use to diagnose, categorize, and share mental health information with other mental health professionals. It is not a top secret manual. In fact, there are multiple sites on the internet to download copies for free. It's written in plain English and doesn't contain too much medical jargon that would make it unintelligible for the average person to read and understand. The DSM is what we all use to diagnose. Of course, we licensed professionals like to think that our years of training make us more qualified to use it. But with the kind of information that has been shared with me by some of my clients over the years, sometimes I seriously have to wonder. I've had many clients state rather matter-of-factly that they have bipolar disorder. But after multiple sessions, they are clearly no more bipolar than I am. That sort of thing makes my skin crawl. But that's another story for a different day. So if you have any doubt as to whether or not you have a mental disorder, that just might be a good place to start. If you feel you meet the criteria, then by all means seek help from a professional in person. Another source might be WebMD. Now, I'm not saying that you should try and diagnose yourself. What I'm saying is this. If you think you have a mental disorder, VQT is not for you. It's just that simple. And when you sign the consent to participate in VQT, you're indicating just that. And if through the course of conversations with you, I start to wonder if you do, I'll inform you of that and send you somewhere. You can come in for an assessment with me, or I would be happy to refer you elsewhere. With VQT, there will not be an assessment of any kind, nor will there be a diagnostic evaluation. If you want an assessment, you can certainly schedule one with me face-to-face in my office, or I can refer you. If you prefer online treatment, Talkspace.com is the place that I would tell you to go. With VQT, I don't assess, diagnose, or treat mental health disorders of any kind, period. I can't state that more clearly. And your signature to the informed consent will indicate that you understand and voluntarily accept this. VQT is restricted not only to non-mental health disorder issues, but also to a selected scope of problems. At this time, there are 7 topical areas to select from. These are featured in my proprietary quasi-therapeutic video series found on the video tab on my website. Weight management, responsible drinking, stress and anxiety management, managing to exercise, performance anxiety, food addictions, and managing your sleep are currently featured. Now, in addition to these specific topics, VQT includes ancillary general topics, including gaining more confidence, motivation, self-discipline, commitment, optimism, or mitigating worry, self-doubt, getting overwhelmed, overthinking things, or playing out worst-case scenarios. Now, this is not an exhaustive list by any means, but you get the gist. These are not mental health disorders. I will be adding new video series continuously based on demand, so if you don't see what you're looking for, please contact me anyway, and let me know what you would like to see. I welcome feedback to help prioritize the order in which I will create new quasi-video series. And I may just choose your topic, and I may just invite you to participate in a case study to help me develop the series. Something you should know about diagnostic impressions is that an accurate diagnosis should be accompanied by what we call a GAF score, GAF, which is Global Assessment of Functioning. This is included in the DSM and is used to determine how well someone is able to function. It's a common practice to include this score with the diagnosis. In my book, it's a very important factor. You'll find a copy of this GAF scale in the margin on this page. Please take a moment to look at it. In my professional opinion, if you score higher than a 70 on this scale, you are unlikely to have a mental health disorder. In my opinion, this is probably the first place to start when deciding whether a diagnosis even exists. And here's a reality check. 75% or more of my clients score well above 70 on the GAF. Now, having said all of that, hear me clear. If in doubt at all, go see a professional in person. Another major component of this informed consent concerns personal health information. By signing this consent, you declare that you have been informed that as a practitioner of VQT, I do not need or want your personal health information, period. And since I won't have it, I won't have to protect it. A big part of keeping the cost of VQT low is to minimize administration, paperwork, and security. These things are quite costly, and abiding by HIPAA laws just adds layers of confidentiality that, again, bog down the process and jack up the price. So, by agreement, whatever you send me or tell me is information that you personally waive the right to protect. Of course, I will protect anything you text me or tell me, just as I do within the four walls of my office. The only difference is that I cannot afford the cost of liability and still offer VQT at a very low cost, about half the cost of any other online agency. So this helps me tremendously to keep costs down. And the bottom line is that most of the information that I might have to protect, I just don't need to do quasi-therapy effectively. And then there's confidentiality. Anything you say, type, or text will be kept confidential and never shared with anybody. That's no different than if you were in my office. However, I cannot guarantee that phone or internet transmissions are secure. Transmissions will be conducted over the normal channels of cell phone and the internet. There are no added layers of encryption. But keep in mind that the FCC already does a pretty darn good job of protecting this information. The government even has a hard time getting cell phone records if they want it. Again, paying for added layers of protection defeats the objective of keeping costs low. So, stray text, hacked accounts, lost devices may occur from time to time. Signing the consent indicates that the risk of such is clearly understood and assumed by the participant. So let me close here by underscoring the key components of this video. VQT, again, is not for mental health disorders. Personal information is not needed or wanted or protected, and maintaining confidentiality of information will be strictly adhered to within the confines of normal cell and internet transmission. We waive culpability for breaches beyond our control, which would be hacks, viruses, electronic malfunctions, or even unintentional user error. Your consent to such is the only way that VQT does not become too exorbitant in cost or too cumbersome to be effective and efficient. So if you have any questions about this information, please give me a call and we can speak about it directly. So, what are you waiting for? Give me a shout.